Only reason a lay person should wear a mask is when they are not well themselves. So let's say if I am having flu-like illness, all right, and the advice obviously is to stay at home, don't mix with other people if you can. But let's say I have to go out for some reason. That's when I need to wear the mask, and it should be that 3-ply surgical mask, wearing the blue or the green surface outside and the white surface inside. And the mask must be worn properly, covering the nose and also below the chin. So that's the only reason, only indication for a lay person to wear a mask. Whether if you go out, if you're well, you need to wear a mask, the answer is probably not necessary, all right? That has not been proven to work. A lot of the coronavirus is actually spread by direct contact with our hands. Now, if our hands are contaminated, and it's very easy to contaminate our hands, we touch everything with our hands. When our hands go up to our eyes, to rub our eyes, in our noses, or put our fingers into our mouth, many of us unconsciously do that, that is a risk of transmission to ourselves. So the other important thing of hand hygiene, and the other thing is to ensure that we don't mess around with our eyes and nose and mouth so much with unclean hands. The vaccine, I'm sure, will come, but it won't come for another year, a year and a half. So at the moment, what we have is what our own body can have. The first layer of protection is, of course, our skin. So the weakness areas will be the mucous membranes. I spoke about the eye, the nose, and the mouth. But the other thing is our own immune system. Adequate good hydration, good nutrition, to keep your body as healthy as possible. All that might help as well. It's clear if you are short of supplements or short of certain vitamins, you may be more prone to infection. And when you get an infection, you may be even more sick with that infection. So these are also good things that we should do all the time, with or without coronavirus, that to maintain our health as much as possible. The most effective thing we can do is, like you say, part of social responsibilities. If you are unwell, you do the best you can not to mix with other people during that period of your illness, and maybe even a little bit after the illness, because even after the fever has gone away, the virus may still be there and may transmit for a while. I'm not suggesting that you have to wait for 14 days, all right, unless you're proven to have coronavirus, but after a flu-like illness, perhaps after the fever is gone, wait a couple more days. Even when you go out, you can still wear a mask, all right, for that whole 14-day period, and you make sure you use hand hygiene well. Now, if everyone who has symptoms do that, transmission in the community will also drop. Unfortunately, there are some cases where the symptoms are not there, or the symptoms are very mild. But we hope that all Malaysians would do that take on their social responsibility better. That if you feel you are not well, try not to go out mixed with other people as much as possible.